Welcome to everybody joining us live and to all of those listening to us afterwards from all across the globe. My name is Lina Badr. I'm the FIP lead for Workforce Transformation and Development at the International Pharmaceutical Federation, FIP. I'm also the lead for this Transforming Vaccination program, and today's event is part of that wider program. We're really pleased to have you today in our fifth event of this year's Transforming Vaccination program, focused on working together across systems to transform vaccination policy with professions, with other disciplines and agencies to establish sustainable policies. Welcome again. Next slide, please. I'm very pleased to be co-moderating today with my colleague Eduardo Savio, who is also the president of the Pharmaceutical Forum of the Americas. Thank you so much, Savio, for moderating with us today. I'll be handing over to him shortly, but first I'd like to just present some background about this program, but first a couple of housekeeping announcements. Just as a reminder, but those of you who've been joining on our events are probably very familiar with these. Just to let you know that this event is being recorded and is being live streamed via YouTube. The recording can then be accessed through our website, events.fip.org. Please do feel free to ask questions that address our panelists using the Q&A box at the bottom of the Zoom panel you see in front of you. And of course, as ever, you are welcome to provide feedback, questions, or any follow-up to webinars at fip.org. Finally, if you aren't already, please do consider becoming a member of FIP. You can find out all about our FIP individual membership benefits by visiting our website, and the URL is on the screen for you there. Next slide, please. The FIP Transforming Vaccination 2021 program builds on the successes and the outcomes of the 2020 program of the same name. Just to recap the key outcomes from last year, it was at the time the first FIP digital transformation outcome-based online program we have ever conducted. It was underpinned by the FIP development goals, and it resulted in a global commitment to action on vaccination in pharmacies, as well as a digital collection that captures all of the outcomes. Everything about the Transforming Vaccination Program 2020 outcomes and this year's progress can be found on our resource webpage, transformingvaccination.fip.org. Next slide, please. 2021 Transforming Vaccination Program, not dissimilar to last year, consists of a number of digital events. This year we have 12 events running across 2 series. Today's event, the fifth one, is actually the last one in series 1, which focuses on towards equity in vaccinations globally. Our next event onwards will look at regional priorities and will conclude the entire program with a leadership summit as well. The 3 key goals that underpin this year's program are equity and equality, number 10, goal number 18, access to medicines, devices and services, and number 21, sustainability in pharmacy. The first of the 2 series comprises 5 episodes. As I've mentioned, today is the last of these 5 episodes. It included opening events. We're running 4 other events. One was focusing on age and life course vaccination, one focused on gender, another on literacy and education, and today's event is on working together and collaboration. The second of the series comprises of 7 of the 12 events that are left, including 6 regional roundtables that look at the world's 6 regions, where we'll discuss and identify the priorities for sustainable access to vaccinations across the regions. And as I mentioned, the program will end with a leadership summit in which we will present another commitment to action on sustainable and equitable access to vaccines through pharmacies. So the key outcomes this year are, in addition to the 12 events, a global commitment, and we will also be publishing in January a special policy collection that captures the outcomes of this program, which does take on a policy focus. Before we begin with our panel today and handing over to Eduardo, I'd like to also point out that we have 2 days to go to celebrating World Pharmacist Day, which falls on the 25th of September. This year's campaign from FIP is a global one. We have gathered testimonials and support from pharmacists and pharmacy members around the world, and we're aiming to collect or cover all 193 United Nations countries around the world. I believe we have hit the mark of 185 as of this moment, and we are calling upon countries from the ones that we have left to join us. And please add your voice if you haven't already. You're welcome to do that from wherever you are, and information can be found on the slide. I'll now hand over to Eduardo, my co-moderator. Eduardo, the floor is yours.
Thank you very much, Lina, for introducing myself. Welcome for this webinar today to everybody. We are very pleased to have you here today. So the speakers today, panelists, are Suresh Bharat from India, Daphne Holt, Meghna Haynes. Next, please. Marlene Haynes, Catherine Milosevic-Kostadinovic, and we are very pleased to have this very valuable panelist, and we perform the welcome to all the panelists. Well, I have the honor to introduce Suresh Bharat, who is Pro-Chancellor from the GSS Academy of Higher Education and Research from Missouri, President, and he also performs as the Pharmacy Council of India. Welcome, Suresh Bharat, please take the floor.
Thank you, Eduardo, for inviting and welcoming. Good evening to all the panelists and viewers, and good afternoon and good morning to others in different parts of the world. Transforming vaccination has become a national as well as a global priority across all segments. The reason is, even though the vaccines are available, the access to the vaccines and the manner in which they are being distributed equitably are all being questioned and seeing how it can benefit across the country. In today's talk, what really we are going to focus is whether there are strategies and approaches in which the equitable distribution of vaccine can take place, access to vaccine is available, and how, if barriers, if any are there, can be removed. One of the major approaches which we are looking at is the collaboration in the health profession to ensure that this transformation in vaccination does take place. We are very well aware that the health professionals, be the physicians, nurses, allied health professionals, collaboratively, we have pharmacists have to work with them. We may be in different segments, we may be in industry, community, and in hospital segments, regulatory, or even in academics. We all have to work closely with the health professionals to really make one difference, that is to provide the care to who need the most, that is the patients. They need our care and we need to provide them the best. And for that, what are the policies that can help us in realizing this transformation? One and most important thing which I feel is the empowerment of pharmacists, if it is done in the right perspective, can help us to move forward and bring about the transformation which we are looking at. And the next one is the early response and control of the pandemic is very, very important. And for that, equitable availability of vaccine is essential. As we all are aware, Gavi, that is the Global Alliance for Vaccines and Immunizations, is investing a lot of money in strengthening the health systems. I mean, their very clear focus is how the health systems can be strengthened to not only meet the challenges of this pandemic, but even what may come in future. So for us, it is time for us to look at task shifting wherever it is needed as pharmacists, and I'll collaborate with the other health professionals and look at a collaborative practice the way we want to move forward. Next slide, please. Now, once having understood that collaborative way would be the best way to move forward to bring about the equitable distribution of vaccines across the world, let us look also at what are those things that are impacting vaccination access and as well as its equity and the sustainability, which would be the next series of talks which is there. Access to vaccination is most important thing if we want to bring about any transformation and particularly bring an end to this pandemic which we are looking at. And for that, equitable vaccine distribution is what is required. Now, if you look at the perspective which is there in front of us, we do have a vaccine available to us. And what we need is we have to vaccine more people and we have to vaccine faster. And for that, necessary authorizations are required. We know that the vaccines available in different parts of the world, in different countries, are being given the authorization by the regulatory agencies in a piecemeal manner with more data and more information required. And besides the vaccine being authorized to make available to the people, what we require is the countries need to also have access to these vaccines. There is very, very limited access. Now, if we do not have this access of vaccines to the countries, they will become the places where the variants of the coronavirus or the other viruses that may be challenged in future may emerge from. So it is very important that we should ensure or even ensure that the risk associated with the variants are reduced, and that can be done by a quick vaccination process. It has been said, even in the WHO, it has stated that unless 40% of the people are not vaccinated across all the countries in the world, only then there is some sort of control that can happen. And 40% of people should be vaccinated before the end of this 2021, and at least 70% by the first half of the 22. And then we can look at some sort of balance emerging in the control of the pandemic. And moreover, now the challenge before us is that only the 10 upper and middle income countries are the one which has got the maximum access to the vaccines. There are many other countries which have got only limited vaccine, and that they will become the center of what we call as the new variants coming in. Now, for that, why there is no access available? Obviously, the resources and the technology that may be associated with that are the challenge. I'll talk about the technology in the next slide. But the resources, that is the funding, is something which we'll have to work at and look at new ways of funding that may be available. And the best way to prevent the pandemic and bring it to a control is by awareness and public health. I think these are the issues which are there, and all these steps taken in the right direction can impact the vaccination which we are looking at and bring about the transformation which we are talking about. Next slide, please. Now, when we are talking about the enablers and barriers in this, I look at two barriers basically. One is the access to the vaccine, and second is the hesitancy or lack of awareness which is there on the benefits that the vaccine can bring in. If you look at the enablers, what can help to overcome these barriers is the equity and the funding which is available for making these vaccines to be accessible to across the world is going to be the first enabler that can help. The second one is the awareness. We all are aware that there are different types of environments existing in various countries based on which people decide whether they should move forward for vaccination or otherwise. I think it is very important for us to use such networks and share data with them that how vaccine can be the solution which they are looking for ending the pandemic. Unless all the people across the world are not made aware of this, I think this will continue to be a challenge in front of us. And next level, I would like to say is that we should share as much of data that is available that supports our ideas, and we have to expand awareness that vaccines are our best hope, and that is the only way to do it. And the collaborative practices that we may bring in with other health professionals, even the what we call as the leaders within the community, if we engage them, I think we try to get a better outcome. And we have to understand what motivates them and try to bring that as a factor in bringing about the information. By taking this approach, the equity first approach, I think we would be able to achieve much more than what we are presently doing. Next slide, please. Now, having talked about the barriers and the collaboration that can help us, I think one of the major challenge which will come, which is presently there and continue to be present before us, will be the policies that are governing the access and the availability of these vaccines. Now we have to always, as a body or as an individual or as a nation, look at policy changes that are required to reduce the vaccine inequity. Now, for that purpose, there are different factors for not having access to vaccine. It can be intellectual property, or it can be the technology sharing that may be a challenge, or the manufacturing capacities, or even equitable allocation of vaccine. These will be the different challenges which are there. Talking about intellectual property, we have been talking about isolated incidences of what you call as IPR waivers being discussed. Now, this are obviously affecting the new discoveries, and better vaccines are not able to come out as a single dose vaccine or other things, because the IPR is preventing people from further having access to the already existing vaccine to develop it to a better stage. I think many of the countries, even though they would have the capability to move forward, they are not able to do this because of the IPR. Only isolatedly we are looking at IPR waivers, but mere IPR waivers will not help, because then the technology will remain not accessible. So sharing of technology is also one of the important policy which we have to look at and see this, how the technology access can also be provided to these countries. And I have myself had interaction with leadership of other countries on other platforms. One of the major things which such countries they have expressed, particularly in the developing world, they have expressed is, if the access to technology is given to them, I think they have the capability for manufacturing medicines. All they need is access to technology and help them to start their own manufacturing processes in their country, which they can provide to their people at much lesser cost than importing from other countries, or even waiting for the donations to come to their country in the form of vaccines, or in the form of money. Either way, they expect that if technologies are shared, they have the capacity to manufacture. So this will help them to reach faster to their people. I think this is one such policy. We will have to look at it, not only share technology and IPR, but help them expand their manufacturing capacities. And wherever such capacities or facilities are available, we should be able to do that. And once we have done these steps, then comes the equitable distribution is very important. And I think countries that have done the major level of vaccination, I think they should look at priority the low and middle income group countries where this vaccine should be made available, and make sure. Even in India, recently, the Prime Minister had made an announcement that the vaccine should be made available to the countries as we had promised to them, that these vaccines will be available as soon as our need gets satisfied, or it needs to the balance where we have achieved our objectives here. Now, moving to the next slide, I would like to conclude that for a broader COVID-era pandemic response strategy, we can be guided by three principles. I think these three principles are valid for any future also, any such challenge that may come to us. First is a robust financing mechanism should be available at the global level. Yes, we have the WHO's COVAX and other such schemes where emergency public health, the benefits can be provided to the people or nations where such medicines may not be available. I think this has to become more robust, where the inequity can be neutralized by these type of funding available for the purpose. Second is a funding mechanism that addresses multiple pandemics, not only the corona, but even the next pandemic or any other thing that may come before us. And lastly, an agreement to share technology broadly across the country should be there, and it should not be case-based whenever there is a incident and start appealing for an IP waiver. I think when such national and international emergencies are declared, it should be automatic that these type of IP waivers and technology sharing policies come into place and position. I think these efforts would help the transformation of vaccination to take place. The collaborative practices along with these policy changes and the participation of health professionals can make a lot of change. Thank you very much.
Thank you very much, Dr. Suresh. Your presentation has been excellent, and you have summarized in the conclusion the three big principles that are very big issues then certainly everybody will have to take into account. Thank you very much.
Thank you.
I'm very pleased to introduce Daphne Holt, who is chair of the Coalition for Life Course Immunization, and will also broaden our perspective. Thank you very much, Daphne, for being today with us.
Thank you very much. Good morning, good afternoon, good evening, everyone. And thanks also to the organisers for inviting me to take part in this seminar. The first thing that I have to point out is that I'm not a pharmacist. I'm an advocate for vaccination at all ages and stages of life. So my remarks all come from the advocacy point of view, and I'm also European. Next slide, please. The number of alliances to change policy and promote vaccination that have been brought together over the past few years is testimony to their perceived success. The Coalition for Life Course Immunisation, which I will call CLCI from now on, has one of its core pillars, the notion of all stakeholder involvement, from policymakers to the receivers of vaccines. And remember, the receivers of vaccines are also ourselves. From the suppliers to the providers. Cooperation and collaboration are key to obtaining maximum impact, where objectives can be shared with like-minded people and a range of skills can be brought together. As an example, and this is a European example, as I say, the European Commission Director General for Health, that's DG Santé, has brought together clinicians, nurses and pharmacists to form the Coalition for Vaccination, which focuses on training for healthcare professionals. So bringing skills together for strategy, communication and for local knowledge. And local knowledge is really important. Next slide, please. So let's look at enablers and barriers in health policy. You may find these things that I've listed here a little bit simplistic after our last speaker, but it must be said that a strong political will to get things moving is a great enabler. And perhaps one of the best examples of this, once again in Europe, was the introduction of the pass sanitaire and the policy of the French government requiring restaurants, bars, cinemas, and nightclubs to check that their clients were holders of the pass before entry to the premises. The QR code on the pass records vaccine doses, test results, and immunity acquired from contracting COVID-19. Immediately after this policy was announced by President Macron, 300,000 plus people booked appointments to be vaccinated, and this has continued. Now, we may not all agree with this methodology, but I think we must all agree that it worked. We, the French, cannot be separated from our restaurants. Of course, we need policymakers to work with us to produce and deliver clear and consistent messages. That's working with healthcare professionals and with advocates, and clear and consistent messaging delivered on appropriate platforms. Because one of the greatest barriers in health policy is confusion. And there have been so many confused messages during the COVID crisis that I have difficulty in picking out just one. And once again, this is very simplistic, but I think the mixed messaging on the wearing or not of masks has to be close to the top of the list here in Europe. These things will be different in other parts of the world, I know and understand. Next slide, please. The contribution of pharmacists is almost immeasurable, actually. Pharmacists have a huge potential to contribute to the narrative in practice, in policy, and in advocacy. The success of the COVID-19 vaccination campaign in pharmacies here in France and in other countries should be continued to include more routine vaccinations, influenza, for example, because this would certainly improve access in many ways. Pharmacists must also be prepared to join in the policy debate and to raise their voices with other advocates. So CLCI would certainly welcome pharmacists among its members. So practically, be prepared to administer vaccines. Policy, be prepared to join the policy debate. And advocacy, be prepared to raise your voice with other advocates. Next slide, please. There is probably not just one urgent policy change, as our last speaker pointed out, but we can help to reach equity by improving access to vaccines, eliminating out-of-pocket payments, and removing need for medical prescription. So if I just elaborate on those, each one, equity could be improved by improving access, as I've already mentioned. Vaccinations need to be free at the point of delivery, and by removing the need for medical prescription once a vaccine has been proven safe and effective. A further point to consider here in Europe, certainly, is the standardization of vaccination systems across Europe, linked with effective communication and systems of call and recall so that everyone knows which vaccines they should be receiving and when. Next slide, please. Finally, I've been asked to provide a success story. Now, I've already mentioned the number of coalitions that have been formed over the past few years, but I have chosen to showcase something slightly more unusual, but highly effective, and this is the Communication Alliance. Vaccines Today is an online magazine on vaccines and vaccination, and if you're not familiar with it, then I urge you to take a look. It was founded by Vaccines Europe 10 years ago, and at that time, it was said that it could not succeed. However, 10 years on, and we are still providing material that is reaching an ever-expanding and diverse audience. And as an example, one of our videos on herd community is used in the curriculum of a medical school in Singapore. I'm proud to say our, because I'm on the editorial board, and we have as our editor an experienced health journalist. And as the composition of the board shows, the board members are represented by clinicians, academics, patient organizations, industry from across Europe. And this shows that by bringing all stakeholders around the table, a success story can be written. And that concludes my contribution. Thank you for your attention.
We cannot hear.
Hi, can you hear me?
Now, yes.
Okay. Hi, everyone. Thank you for this opportunity to talk and present some of the work that we're doing here at the CPA. Next slide, please. So it's really great to have this opportunity, and I'm going to quickly talk about the work that the Commonwealth Pharmacists Association are doing around forming intra and interprofessional alliances to help drive the change around transforming vaccination policies and achieve equity. Next slide, please. Some of you may know the Commonwealth Pharmacists Association well, but for those that do not, the CPA is a body that unites pharmacists from across 54 nations of the Commonwealth, covering every continent across the globe. Our vision is to empower pharmacists to improve health and well-being throughout the Commonwealth, build strong and diverse networks between pharmacists and other health-related groups to achieve our 3 core goals: to develop the pharmacy workforce and build capacity, to strengthen healthcare systems through the safe and effective use of medicines and vaccines, and through our advocacy and policy work around improving the access and quality of medicines and vaccines, also utilising the full expertise of pharmacists at all levels of medicines management. Next slide, please. So this slide shows an overview of where the CPA sits within the Commonwealth. We work closely with our national pharmacy associations in each member state, and build, along with our strong professional alliances with other bodies such as the Commonwealth Health Professionals Alliance, the Civil Society and the People's Forum, we're able to bring the voice of grassroots practitioners, as well as those working in regional and national roles, to the Commonwealth Health Ministers and heads of government, and advocate for changes in policy, particularly in this current climate around medicines, vaccines and vaccinations, to ensure access, equity and sustainability. Next slide, please. So in May this year, the CPA hosted the Civil Society Policy Forum, which was themed around equitable and appropriate access to medicines and vaccines in the context of COVID-19. As we're all too aware, the pandemic has put our health systems under immense pressure and exacerbated many underlying issues that were related to access, as well as demonstrating how health inequalities play out on the global stage. And this forum brought together a wide spectrum of practitioners and organizations, from frontline pharmacists driving national vaccines procurement and vaccination programs in low middle income countries, to practitioners representing the humanitarian sector and the challenges faced around access to medicines and vaccinations for displaced people, often some of the most vulnerable in our society. So the forum was held in May. Next slide, please. So this diagram summarizes some of the collective suggestions that were discussed in the forum around the barriers and the enablers, what we can do to overcome these barriers to implement better access and equity to medicines and vaccines, and in turn, better vaccination equity. Some of the core components that were highlighted were the four in the center of this diagram, one of the primary ones being pricing and reimbursement. Around that was the production and supply process, including the sharing of expertise and harmonizing regulation and licensing. So it also needs to be supported by a robust health infrastructure, well-resourced with a multidisciplinary workforce in which pharmacists play a core part. And all around this, encompassing this, we need to take into account the patient environment, and address some of the drivers of patient hesitancy as a barrier to accessing medicines and in turn accessing vaccinations. And we felt that all of these factors needed to work together in a very collaborative, multi-stakeholder approach with ongoing evaluation to ensure that policies do not widen disparities. Next slide, please. So this slide shows that the themes were translated into 5 policy recommendations that were presented to Commonwealth Health Ministers post the Civil Society Forum at their annual meeting. And these recommendations were around the whole systems approach. We need to take into account the patient environment and address issues around hesitancy and information, utilizing a multi-stakeholder, a multidisciplinary workforce approach. Recommendation 2 was around price transparency. This needs to be increased so we can facilitate more informed price setting, which we know hugely affects equity and access. Recommendation 3 was around local manufacturers and medicine suppliers to improve collaboration, to support local manufacturers for more sustainability, and to be able to increase the security within countries of medicines, of access to medicines, and in-time vaccines access as well. Recommendation 4 was around vaccines equity, to commit to collaborating with governments and civil societies to improve sharing the vaccines and contribute to the COVAX pool, but also to utilizing the full skill set of a multidisciplinary health workforce so that we can facilitate universal access. And the last recommendation was around the sharing of knowledge and capacity building, so that each member state to take leadership in supporting policy states towards increased knowledge sharing and local capacity building, as well as a very topical sharing of intellectual property to help foster cooperation and collaboration. One of the questions that were asked by this panel was to say, is there one key policy recommendation that we could recommend? And I found this quite hard to pin down because it is so very multifactorial. From the forum, we had lots of examples of how multifactorial policy change can be. For example, our UNICEF colleagues based in India highlighted that India had the largest global public health drive, but they also had challenges around the logistics of people coming back to take the second dose. Our colleagues in the Caribbean highlighted the issues of regulation and licensing, with a large proportion of their population being under 18 years of age. Vaccination drives were not necessarily able to meet the needs of their local population due to licensing requirements. And again, in South Africa, our colleagues shared that the timeliness of licensing was an issue where, despite having stock in place and the vaccinations centres ready to go, at rollout, the vaccines were found to be not effective against the current variant. And so that, again, delayed vaccination. So in terms of, is there one key policy recommendation? I would say that there is not one specific one, and it is very multifactorial and needs to take into account the needs of that local region. Next slide, please. So this slide shows that going forwards, what are we at CPA doing to help build on some of these recommendations and support the contribution at pharmacy at all levels? We know that pricing is a long-standing barrier to access for medicines and vaccines. We are working with the Commonwealth Secretariat on the information and price sharing database that's in development. The database aims to increase price transparency and to facilitate more informed price setting and affordability, which in turn will improve access and equity across the Commonwealth. The database will be launched in October, so next month. And along with it, we're looking to build a forum of national procurement leads to help facilitate more transparency across the regions. If you're interested in this, please do get in touch. Alongside this work, we're continuing to work on the whole health systems approach, in particular developing the pharmacy workforce and supporting pharmacists as key health workers. They're often the most accessible healthcare professional in many communities and excellent candidates for supporting vaccinations and accurate information. And also we're working collaboratively with governments and civil societies and our health alliances to support policy change and involve pharmacists in all aspects of vaccinations. I hope this presentation has given you a brief insight into the work we're doing at CPA around driving forward the vaccinations agenda. And thank you to FIP and everyone here for all the work you are doing on behalf of the profession in this space. Thank you.
Thank you very much, Meghna. It has been a pleasure to listen to the CPA work that is on progress. Thank you very much for sharing the 5 policy recommendations and which are next steps to move forward in the perspective of achieving success. Next, please. Now I'm very pleased to introduce Catherine Milosevic-Kostadinovic, who is Chairman of Assembly of the Pharmaceutical Chamber in Montenegro. He will introduce in this presentation transforming vaccination and vaccination policy. Please take the floor, Catherine, today. Thank you for accepting our invitation. Katerina, are you here?
Yeah, I'm here. Can you hear me?
Okay. Yes, we can.
Yeah, I don't see the sharing, but I hope that you are getting me. Yeah.
Yes, no problem.
I want to say hello to all the panelists and all the participants today. And I want to share with you our work on vaccination through the pharmacy in Montenegro. So talking about all this, I'm very close to Daphne's point of view and advocacy for all this, because we working on this matter in Montenegro find out that advocacy is what we need. The first question was, who is in charge and with whom we have to stay in touch during this transformation. So we have 2 laws which are working with this matter. This is a law on protection of the population from the infectious disease, and the law on the conditions and manner of implementation of the immunoprophylaxis. Also, the minister, the proposal of the Institute of Public Health, form an expert advisory board for immunization, which has 11 members and consists, if you can see on my slide, usually of doctors and no pharmacists at all. Even the law says that here have to be other specialists relevant to immunization and issues of immunization. Next slide, please. So our steps and who is in charge was around the lighthouse on the shore, and we make our list of contacts where we have to start. So the contact with FIP and pharmaceutical chambers was the first initiative we got for vaccination through the pharmacists in Montenegro. The second one on the list was Ministry of Health and Institute of Public Health. Then contact with vaccine manufacturers, contact with our pharmacists and pharmacy technicians, then with patient and their associations, contact with the medical chamber, and that was the list we made first for the implementation of changes. Next slide, please. So the contact with FIP and pharmaceutical chambers were nice, and everything we got was support, understanding, need of help, experience, guidance, all the things that in first step we thought will lead us very fast in resolving the transformation of vaccination policy. Next, please. And on first step, the contact with Ministry of Health and Institute of Public Health was this slide, which was thought from all the participants and panelists that something is missing. Yes, something big is missing in our work. We have no answer for any step we took towards Ministry of Health and towards Institute of Public Health. So no answers, no connections, and just emptiness of this slide says that advocacy on this step is main issue for our work. Next slide, please. In contact with manufacturers, we have all kinds of promises, and we rely on them because in all these talks, we have promise for help in education, in training, in updates, in managing difficulties, and help in all kinds of questions we have. And in these first steps, we really get help from the manufacturers, and we need that help, and we rely on it in future. Next slide, please. In contact with our pharmacists and pharmacy technicians, we at first get very big interest, but in talks we take in time, the problems get out of the box. The main pillar was that pharmacists are saying that every issue in work with pharmacies is that pharmacists is giving all their space, their concerns, their work, and all we get in back is getting problems. So some of them were asking, is it okay to say no, I don't want to do the vaccination? Or how many paperwork, how many outcomes I have to fulfill, and all kinds of questions which are really important to hear and manage. But in spite of all these, by pharmacists, we get always an incredible enthusiasm, and a lot of our licensed pharmacists want to participate in vaccination. Next slide, please. The contact with patients and their associations were always with all kind of positive outcome. So the patients are ready to start immediately. They just ask where we can go and what kind of support do you need. Certainly what is the cost of such a step. And always we get the answer that this is the best ever solution, because they used to use our desk for all questions and all askings they have towards the therapist. This is an easy approach, and I think the patients are the readiest persons in this transformation of vaccination in our country. Next, please. We really need to say that we really thought that we will get support from our colleagues from medical chamber and support from doctors and health facilities. But this came to be like cloudy weather, like shown on my picture of Tara River. It is really, really interesting that the first answer we get was no, and how you will know that, and how you will do this. And the first question from our side was, okay, who is doing the vaccination in healthcare facilities? And they then stopped because they found out it's a technician, it's a well-trained technician who is giving the vaccine. And there is not just a no answer anymore, but don't answer at all. So the second barrier we found out is our colleagues in healthcare systems. Next slide, please. So all of this make us to consider that the rough waters and future that we are entering, we find out this will be a difficult task. But our decision to participate in vaccination is really a dedication. The first step that we have to put forward is that this have to be a paid service, because this is not expense. This is a saving of money for the government and for the healthcare system. And this is, I think, is most important thing to say. Also, we have to change the perception first with our colleagues. We have to build our position first with our colleagues, and to change our involvement in talks with government, with policymakers. And this is the part where we need to change our participation. And this have to be our start, because the changing of vaccination policy in the country is something we have to do first. Next slide, please. So in making a conclusion and working on this presentation, I watch on 10 lessons to pass to the child in my kitchen, and I find out that all 10 is saying about our position in the society and in medical care system. So like as we are a child in developing our position in the society, in the healthcare system. And really reading these 10 lessons is something which have to give us more power in talking about vaccinations. There is always something good in every situation, even bad. The good attitude open us doors and stay curious and never stop learning. We will start learning the vaccination process and our skills, even we are not getting the license to go further. Never let someone make you feel small. We, in matter of this and vaccination, we really feel small, and we are uncomfortable, and we have to speak it. And we try not to waste our love on people who want to return to us and get the vaccination, our patients. And really, we have to be kind to ourselves, because the pharmacist is always working, while working with patients, always think on patients, on their benefits. And we have to start to think that we have to rely really on our side to be fast and good in changes. And next slide, please. What we will do in waiting for answers is to get on our ship for vaccination. We will work on education, we will work on new manual skills, we will work with our pharmaceutical technicians who have to participate also in vaccinations. We will work with patients, we will stay in connection with manufacturers, and we will try to work with other medical professionals, as always with Ministry of Health and Institute of Public Health, to make them realize that we have to be their allies, and that the pharmacists are really the first and big chain in a big chain of working with patients, and that we have to be in transformation of this vaccination policy. Thank you for hearing me, and have a good day. Thank you.
Thank you very much, Katarina. Your presentation is really very good for so many countries that are in the same step of this long journey, and also very valuable to inspire and to see that the barriers we share are quite similar in all over the world. Thank you very much, Katarina. Your presentation is very, very useful for many people. Now I'm very pleased also to introduce Marlene Haynes, who is Director of Professionals Development in COVAC and the Pharmacist Task Force Leader Vaccination. Thank you very much, Marlene, for being with us today and for accepting our invitation.
Thank you. Thank you very much for the introduction. Hello, everyone. I was asked to talk about the added value of a multidisciplinary approach in the development of vaccination services. And I will try to show how important this is and why the pharmacist in this multidisciplinary environment is so important to ameliorate the vaccination rate and the impact it has on access. Next slide, please. It is important to look how all this was prepared in the past, how we deal with it in the present, and what we can expect in the future. And undoubtedly, the past is a source of the future here also. And even though the role of the pharmacist in Belgium in the past was only to raise awareness, only sensibilization, by properly mapping the added value of the pharmacist in this sensibilization, we have undoubtedly been able to make an important contribution to demonstrate what the pharmacist's proximity really means. In addition, continuous work on the dissemination of international experiences is also very important, and as well as our own additional research. And finally, I'll show you that being prepared is very important. Being prepared is what it really makes. Next slide, please. With regard to the sensibilization role, we encouraged and confirmed pharmacists a lot in this role, and we have been closely monitoring for 7 years how many flu vaccines were dispensed by the pharmacist in the ages of 65 plus, in the age of 50 to 65 years, and younger to 50 years. There was a race, and it illustrates the potential of sensibilization by the pharmacist. At the same time, we were confronted with a stabilizing and even slightly declining vaccination rate, despite the fact that more vaccines are being dispensed by the pharmacists in these age categories. It is good to know that only a small half of the vaccines are dispensed by pharmacists. For instance, for rest homes, the authorities are currently working with tenders, and also a lot goes through company medicine services. The next slide, please. For about 5 years now, we had a pop-up in the software of a large group of pharmacists, that alerts the pharmacist that the patient in front of him belongs to the target group for vaccination against flu. And this pharmacist then starts the conversation and registers whether the patient has been convinced, whether he wants to be reminded later by this pop-up again, or whether he declines. By the way, we also do this for COVID-19 vaccination, and especially for COVID, we were able to find out that 4.8 million vaccination conversations were held in Belgian pharmacies between mid-May and early September. This is a huge amount, knowing that the population of Belgium is only 11 million people. This made a great impression. This shows the proximity of the pharmacist. For influenza, we ensure that the pharmacist receives a monthly report on how he is performing, how many vaccines in each of the 3 age categories have been dispensed so far, how does this compare to the situation at the same time the years before, and how does this compare to a benchmark? Next slide, please. A second important point was the dissemination of the evidence available from international experience, thanks to FIP and all colleagues who preceded the vaccination in pharmacy and have published their data. We started in Belgium with the Royal Academy of Medicine. This is an advisory board of the Minister of Health, and we were able to obtain that this Minister of Health asked formally this advisory board for their opinion concerning vaccination in pharmacies. The first time it was a question about vaccination for flu, and the second time it was for COVID-19. And the answers were both times very, very positive. From that moment on, we systematically informed opinion leaders, the government, experts, and so on, and we shared evidence. And with a group of students, master students, we realized our own small-scale research in which we focused on the opinion of the patient, the opinion of the pharmacist, the target group we should focus on, how the communication should be, the collaboration between healthcare providers, education of vaccinators, and the comparison of the education of vaccinators and how the education of the pharmacist should be, and the practical and organizational requirements. As soon as the discussions about COVID vaccination started last year, we presented systematically ourselves as a very constructive partner looking for solutions for existing problems. And because we saw that there would be a shortage of vaccinators, we started already to train pharmacists to become vaccinators in January 2021. In 6 months, we trained 3,500 pharmacists with a very extensive training program that, as our research had shown out, was much larger, much more extensive, and much more rough than the program of, for instance, nurses or doctors. We did this without any legal framework and for vaccination by the pharmacist. And even worse, if the pharmacist would vaccinate, he could even be sent to jail. That was written in the existing law. This for influenza and all other vaccinations in normal conditions. But there was also this new COVID crisis law, whereby vaccination against COVID-19 could be delegated to other professions if there were too few vaccinators, but the conditions were very, very strict. For instance, there may be no single doctor or nurse anymore who can still be used for vaccination, or the vaccination must be ordered to be done by the pharmacist, but it's the doctor who has to give the order to the pharmacist. And it is also to be done under the supervision of a nurse. It's not exactly the law we dreamed of. So we still are limited in reaching people for the vaccination. We can reach them for sensibilization, that we showed clearly, but for vaccination, we are still very limited. Next slide, please. The enormous complexity of the COVID-19 vaccines made that there was a need for pharmacists to take the lead in preparing vaccines for mass vaccination in the vaccination center. And so we engaged 500 pharmacists. Pharmacists are used to work together with doctors in normal conditions. When it comes to refer patients, when it comes to clarify a prescription or to adapt a prescription, but they are not used to work together in one building. That's why they learned. That's what they learned then, step by step. In the beginning, very difficult, but day by day, trust was built on. The biggest problem, of course, is a competition that doctors and nurses see when the pharmacists also will vaccinate. And no minister wants to take the risk of troubles with doctors. But by working intensively and constructively in preparing vaccines on the one hand, and also working on sensibilization of patients who cannot be reached by doctors or nurses or other healthcare providers, we have won a lot of credit. But we are not yet there. We are not there yet. To take a look at our strengths and weaknesses and what the opportunities are, we see that the fact that the profession by the education is prepared is very strong. Imagine how present society will react if one day there is a problem with vaccination rate and that 3,500 pharmacists were ready, having the best and closest relationship with the patient, and that they were not allowed to vaccinate. That is what is happening today. And we see that step by step in cities with lower vaccination rate, the authorities start to involve pharmacists in the vaccination process. Next slide, please. You may skip this slide. Next slide. If we have reached today the point that we can reasonably expect legislation for vaccination by pharmacists against COVID to be introduced, then this is certainly due to continuing to work constructively in a multidisciplinary environment, even if we have often had to handle very hard criticism. There were unsolved problems, despite much effort. Annual vaccination campaigns without any increase in vaccination coverage, too few and too overburdened GPs, a part of the population which is never reached by general practitioners and nurses, especially in large cities. The fact that there are too few GPs, and this need is clearly mapped. Because the idea of vaccination in pharmacy from time to time popped up in the press, the public also became familiar with the idea of vaccination in pharmacies, because the citizens themselves too, they have to get used to the idea that it can happen in pharmacy. Experts were informed, and this all made that the search for enablers, for crowbars, was beginning. The fact that we have trained 3,500 pharmacists was a crowbar. It was a real enabler. That we could say, if you need us, we are ready. If we are prepared to engage. We made a clear vision note and did a financial proposal that cannot be refused, in which the essential is that we are convinced that the technical act of vaccinating should be paid in the same way, whether the vaccinator is a doctor, a nurse, or a pharmacist. That was new, because the difference between a nurse vaccinating or a doctor vaccinating is very big in Belgium. It was a real enabler, and also because so much money has been spent in COVID vaccination. And also we have fully prepared the legislative changes that should be done. In conclusion, we identified problems, we met clearly the problems, we worked together, and working in vaccination centra, in vaccination centra, pharmacists and doctors build up trust. They learn to work together, better together, and to have more respect for each other. As every political level knew already the international evidence and our own results, when all those pharmacists are educated and all administrative preparations are made, the Corona Commissioner now asks us to vaccinate in the pharmacy, and he decided, the Minister of Health, to make the administrative preparations. So at this time, it seems to come, and that's what we hope for. And that's where we are now, but still we are not sure. It may be clear that without a multidisciplinary environment component, we wouldn't be as far today. And we think this will transform vaccination on a national level, because the pharmacists will reach a part of the population that has never been reached for vaccination. Thank you for that, Jensen.
Thank you very much. Congratulations for the steps you have achieved, this impressive strength that has been built along 2021, and your commitment that is in place. So congratulations once again for what you have done, and the perspective to achieve 80% of the population vaccinated is really a goal to be achieved in the future, and to keep it also for next period, for next future. Thank you very much. So now we are open for questions. I have read in the QA box one comment that has been shared on the relation that it would be very useful to have this webinar 1 year before now. Yes, with no doubt. But things have the preparations, and also the experience needs time. And what the FIP and our colleagues can say today is what they have shared along these years, in the previous year, and the perspective for the future. Vaccination will keep an important and a big issue for the whole world, and not only in 2021 or 2020, but for the future, with no doubt. So we are open to listen to your comments or to your doubts.
Thank
Lina?
you. Eduardo, thank you so much. We do have a couple of questions coming in, so I'll field those and maybe ask our panelists all one question about working together and what we should do coming up. But let me first go to the more specific questions. I know Marlene's already answering a question from Luna about how accessing some of the research papers she's referenced, so thank you for that, Marlene. We do have another question about equity. With the new recommendations of taking a third shot of COVID in some countries, and some other countries, especially low and middle income countries, didn't even arrive to 100% of the first dose. So how can we achieve equity in vaccinations globally when we're having such variation in terms of access to vaccinations around the world? So I'm not sure who would like to answer that question. I'm happy to invite a couple of our panelists. Maybe I'm going to call upon Meghna as a first start, because you do have a breadth of knowledge about Commonwealth. There is that variation within the Commonwealth as a sub-regional category, if I can say that. So what are your thoughts on this?
I saw that question. It was a brilliant question. Thank you. And it is a challenge. I mean, we are hearing of places where we're still struggling to vaccinate frontline staff, whereas other areas are already on vaccine 3 or the booster dose. So in terms of how to improve equity from the Commonwealth perspective, we are trying our hardest to advocate for more contributions to the global pool and to have people have access to that. That's one part. And then the other part is the advocacy channels that we're doing, as well as, I know I mentioned pricing in my webinar. Pricing is a big thing. It's a big challenge for many countries, and it is a barrier. So we are trying to work on actually minimizing that as much as possible to improve access and then equity in turn. Thank you.
Thanks, Meghna. These are very high-level mechanisms for addressing this. I think it does differ depending on what platform we're talking in, yes, and what we're talking about. So maybe I'd like to go around, Eduardo, if you don't mind, going around the panel with this same question and seeing how their perspectives differ. So maybe I'll call upon Daphne. Daphne, coming from the Commission, again, what are your perspectives on this? With this much variation, what mechanisms can we employ to try and reduce that gap and just come a little bit closer?
Okay, first thing to say is I'm not from the Commission. I wish I was. It's an almost impossible question to answer, and I guess I'll ask another question. The world, the WHO, we already have in place a very good system for vaccinating against polio, for example, and it seems to me that to get down to the people who really need it, I mean those people on the ground who need to be vaccinated, rather than to their governments, perhaps. Could there not be the same system for COVID-19 on the basis that I fancy this is going to be with us for a very long time yet, to perhaps utilize the same kind of system, the same kind of financing system, the same kind of delivery system as one is for polio at the moment? It's that may well be, once again, something that will take a long time to do, but it seems to me that if there is a mechanism available, if there is already a tried and tested way of doing this, maybe we should start to think along those lines, rather than trying to invent a whole new way of doing things.
Thank you, Daphne, and apologies, I did mean coalition there. But
oh, I'm sorry.
No worries, but thank you so much for that. I'm going to go to Suresh, actually. What are your views on what you're hearing?
Thank you, Lena. My view is there is a need for us to map where the inequity exists and what is the reason for that, whether it is the access to the vaccine itself, or the distribution within the country, or the resources, and try to address specifically that nation's need or that region's needs, and it is possible to address the inequity. Because in some countries, the vaccine may be available and enough quantities also would be there, but they would not be reaching to the people for various other reasons. So I think if this is addressed, I think some of this inequity can be addressed. We have to map individually each country, its needs, and see what needs to be addressed for that country.
Absolutely. I think a tailored approach works really well for national level addressing of the issue. That's absolutely true. Thank you so much, Suresh, for that. Katerina, I'd love to hear from you.
So I'm hearing all the answers about this talk, and I think the next question I see on Q&A board is also connected, even for my country, is that even we have enough vaccination and the vaccination policy is made like it, so it's at this moment we can approach to get vaccinated for patients in the medical facilities. We have a situation that all of those who want to get the vaccine for COVID took it. And the other 50% of the people which are not vaccinated at this moment with even first dose, the reason is the access. The reason is their decision not to take the vaccine. So the advocacy on this field also have to be a matter of discussion. And we have a situation that we need to get to the people the good information and good reason to approach to the vaccination.
Thank you for that, Katerina. Oh, go ahead, please continue.
No, that is something that I want to connect in questions on the board and talk about being an equal in getting the access to the vaccine, but also we have to find the gaps where our patients are not vaccinated and the reasons why.
That's really important, Katerina, and it links to some other comments coming in the Q&A box about the legal aspects of allowing pharmacists to vaccinate. That's a huge enabler as well. So that's obviously really important. The obvious reason we're here today, actually. What we believe that we can transform vaccination through widening access through pharmacies. Eduardo, did you have a comment to make? And then we can hear from Marlene as well.
Yes, I don't know, Marlene, if you would like to add something before.
Yeah. Well, I think that for many countries, price maybe limit access, but in Belgium it is not the case for vaccines. It's not the case that that the price is limiting in most cases. For instance, for pneumococcal vaccine, yes, it is, but for most vaccines, it's not the case. But I think that the proximity of the healthcare providers to the citizen, to the patient, which is not a real patient because he's not ill, we are vaccinating healthy people, but to the citizen, that is very, very important. And I think that a very important part of the population is never reached by health talks, by health messages, by vaccination messages through other healthcare professions, and everybody comes from time to time in a pharmacy. So that's an important role we have to play in connection with other professions.
Thank you very much. We have received another concern in the QA box, and that it says that he or she, what is the role of healthcare professionals who are not vaccinated in vaccination hesitance of public? It's a good question that goes all over the world. I don't know who would like to answer first. Suresh, maybe?
Like if the health professionals, they have not vaccinated themselves,
Yeah.
It must be for a obvious reason. I think they are the most, what you call as educated or learned about the benefits the vaccine can produce, as well as all the safety related issues that have been already addressed. I think that cannot become an excuse for telling, because the health professionals are not vaccinated, so why should we get vaccinated? I think that's just a excuse trying to pass it on. So I think health professional, if he has not vaccinated himself, there must be a reason for that. I think maybe a medical reason or otherwise he has that. I think that should not be an example for us to follow.
Thank you. Daphne, could you please answer your perspective in this issue?
All I think I can say is that all healthcare professionals who are listening to this, please get the COVID vaccination to protect both yourself and your patients.
Thank you. Okay, please, Lina, sorry, do you have any other question?
I can't see other questions in the box at the moment, but maybe just we'd love to hear a final message from our panelists. Of course, as FIP, we're hosting this event today, and we're very grateful for your collaboration. But what would you want? What do you think FIP can do a bit more in terms of working with you or others, you think? How can we capitalize on our position as the world's largest pharmacy federation to widen access to vaccination in pharmacies? Obviously, we think we know some of these answers, and we're providing some of these programs and trying to build on partnerships with a lot of the organizations that the panelists represent today. But we'd love to hear your very honest view and what is the one thing we should be focusing on, if there is one. I know it might be a difficult question, maybe putting some of you on the spot, but it would be really good to hear from you. And perhaps we'll go through the panelists again and then maybe end with that, Eduardo. Maybe starting with Katerina.
Yes, so from my point of view and my point of view of involving pharmacists in vaccination at all, not just COVID vaccination. COVID maybe gave us a chance to be closer to the answer of involving pharmacists like a point of pharmacy, like a point of vaccination. But I think that on the behalf of FIP, what I, at this place in my country, need is maybe direct connection of FIP through our chamber to our policymakers. Because sometimes when you get the word abroad, word from the World Organization, and this can help with our, give us more strength and give us more help in exact moment we need it for that slight change in thinking, and yeah, we need a policy changing. All other steps, I think, are more reachable for us. So work with patients, work with our colleagues for manual change and change of the environment in the pharmacy to get in vaccination. It is now seems easy in looking for policy changing. So that's my point of view. Thank you to all you participating today, and Yulene for nice holding all the thing together. Thank you very much.
Thank you,
Thank you,
Katerina.
Catherine.
And as a representative of one of our member organizations, we will take this call from you very seriously. And we agree that supporting policy change is not easy, but we can work with you to develop tools to really influence policymakers in your country. Thank you for that, Katerina. I'm going to move to Meghna. You know, Meghna, Commonwealth Pharmacists Association and FIP have a very long history of collaboration. And you know what, I guess I love the verb Katerina used, which is what we need. What do you think you could need from us? Not that you need anything, but what would that be?
I actually echo Katerina's comments to say that it's definitely around the policy and advocacy support. We have a lot of support through that, but we know that in some of the Commonwealth countries, the developed ones like Australia and Canada, etc., where vaccinations through pharmacy has been very successful, it would be great to take the good practice examples, the learning from that, and translate it into tangible ways that we could implement that in low middle income countries so that they can stand up and say, look, these are successes, let's do this here too. And I know we're working together on trying to build some of those tools and resources to push forward the policy and advocacy piece to really drive that.
Thank you for that, Meghna. Really, really helpful and useful. Pleased to have you with us today. I'm going to move to Daphne. Daphne, as coming from the Coalition for Life Course Immunization, and coming from that global health perspective, and obviously a lot of us here represent the pharmacy, so you do have a different view on that. And again, what would an organization like FIP, a health professional body, need to do or can do or should focus on from your point of view?
I think this is probably true of all organisations and professions actually, but the idea that to actually get anything done we need political will, and I think it can be shown that if the governments and politicians and policymakers want things to happen, then they do happen. And I think all of us have to work towards that to make the policymakers understand what is really needed, rather than what they think is needed. So many people have spoken about what the patient's needs are. We need to think about that. We need to think about what the professionals need, pharmacists, doctors, nurses, the whole healthcare profession. And we need to make policymakers and politicians understand, so that they have the will to move these ideas forward and to make it happen.
Absolutely spot on. Thank you for that, Daphne, and really aligned with what everyone's saying, and starting with Katerina. And maybe one more sort of representative from some of our member organizations, Marlene, what is your view as well? We'd love to hear what you think. If you could unmute yourself, please, first.
Well, I completely agree with Daphne that the political will to make the change and to really goes into the needs of patients, of the population, and not be distracted by the fact that professions want to protect themselves and to keep up bad policy because professions are protecting themselves. We all have to look for the real needs, and those have to be the goal. And then I think that political will to change things, that is the most important, and not to be afraid of discussion with some professions, but to go forward together.
Absolutely. Thank you for that, Marlene. Suresh, you're coming from that viewpoint of education, actually, so slightly different to some of the perspective here. Could you tell us what your thoughts are from that kind of angle?
From the education perspective, what I look at it is the pharmacists are trained to have, the pharmacists have the competencies that are required to provide various levels of healthcare to the patients and even to healthy people. Empowering the pharmacists is a very important aspect which I think FFP can advocate and take it further. Because though pharmacists are qualified, trained, and available, as said by Marlene, because of these professional issues which they are there between the professions, the empowerment really does not take place. I think that's very important. Empower the pharmacists, whether it's vaccination or other interventions that may be required to be carried in the medication management. I think the pharmacist should be empowered to carry forward these things. This is my thought as an educationist, I would like to say. To that, I will add one more point is that one of the major challenges which is there is the delay in the authorization of the vaccines being available to the countries. I think though costs of vaccines, lesser cost vaccines are available, because of the various policy procedures that are associated, these become inaccessible to many countries to do that. I think FIP can strongly work with them if the vaccine has proven its efficacy and is being administered to larger population wherever it is being manufactured or it is being delivered. I think that acceptability of that vaccine should be become a way of a process for any country to be taking further. Of course, there are legal issues to be addressed at each country level, but I think this can definitely be put forward.
Thank you, Suresh. And we cannot address practice policy change without looking at the full spectrum or continuing, starting with education. I'm going to be cheeky, and before handing over the mic finally to Eduardo. Eduardo, we have you here as a co-moderator, but you're also president of the Americas Forum. I'd personally like to hear your views as well. From a regional leadership point of view, what would we need to do first to really try and implement change in this in policy in this area?
I think that we are on the right road. The barriers have been addressed, and here it has been very useful because there are those who are in the starting point and has addressed the barriers in a very good perspective as Catherine. Many countries in the Americas are in these situations. There are others has moved in some way as in Belgium, and there are already who has performed an excellent role in this COVID vaccination campaign. So we have the three levels, and all this policy development that has been shared today for all the speakers that I would really appreciate has shown how in each level there are different barriers to be addressed, that we have strengths. And what has been said here, that the needs of the population is our goal. That is the main things to have and to keep in mind. That is true for the Americas, for Africa, for Asia, for Europe, for all over the world. So we are moving together, taking into account the needs of our population. So the things of changing policy, of being performing legislative changes to enable our professions to perform our role, I think that this is the main things to do in the future. So thank you very much to all the speakers for introducing your perspective, for accepting our invitation. Thank you very much, Lina, to perform as co-moderator, and to all the staff of FIP, to Noor and Mila, to be in the backstage and to enable us to work properly. In 2 days, we will be celebrating the World Pharmacist Day, and in the way we really like working together. Thank you very much for joining the celebration, and I hope to see you in next FIP digital event. Thank you for joining us, to all the participants.
Thanks very
Goodbye.
much.
Thank you.
Bye.
Bye for now. And just as a last call, please join us in our next event as part of the Transforming Vaccination program. If we go to the next image, you'll see a QR code that you can scan to attend or visit transformingvaccination.fip.org. For all of FIP's event, the next image will show you the URL link through which you can visit and attend all of our events, not just Transforming Vaccination program, but many, many other programs we offer. Thank you once more. Bye for now.